Alright, I'm starting this video on
Uh-oh. Dun, dun, dun. Alright.
This is Zack, the excellent nurse.
Go Gators.
Hey. And this nursing student. What's your name, ma'am, again?
Victoria.
Victoria, okay. Victoria. And this is my foot. When I sent my sister-in-law a picture of this, my foot, she cried.
Really?
Her and my wife. I was just like, wow. And wow.
Did you get that garbage can for me?
Yes, sir.
And me with my thinking, I'm going to send a video now.
You're gonna do it right?
Hey, man.
Thank you.
No, they really be concerned and stuff, so I just show them what's going on with me.
Put the end of this one. Ah, thank you.
Wow, that thing draining, ain't it?
Mm-hmm. Dr. Rafai did a good job on it.
Wow. And that Santil took off something might look like.
That Santil is some good stuff. All right. See what Dr. Alston wanted was he wanted Santil on the actual wound bed.
Okay.
And then and then a wet to dry dressing on top of the Santil. But at the same time, we're actually trying to keep the area in between his toes dry in order to keep circulation good.
Okay.
So this is a wet to dry dressing, but this is actually just plain gauze in order to keep his toes dried out.
Okay.
See.
Ooh.
And sometimes when you're taking a dressing like this off, if it does tend to stick a little bit, you can actually use the wound cleanser to kind of moisten the area.
Okay.
That's just that dry gauze that was between his toes, and everything looks good and dry. So it's served its purpose well. Yeah, that's stuck on there, so I'm gonna loosen it up a little bit. Coming over here. Yeah.
Mm-hmm.
Man, it don't even look like my foot. Look nothing like the other one. Golly. Three-toe Joe. Three-toe Mo. I feel it.
All of this like dark tissue here, that Santil actually basically helps break down all of that dead tissue in order to help the new tissue grow in.
Okay.
So all of this will like eventually get less and less, and it'll start to turn more pink and red.
Okay.
And I'm just palpating the area and looking for any oozing or any leaking or anything like that. Everything looks good.
And this will be an educational video from my wife too, so she can go back and look.
Yeah.
And know how to do the dressing.
All right.
Is that ball man?
Mm-hmm. That's bone.
No,
Bone. Wow.
like the inside of it. Is that the marrow?
Yeah.
Wow. So skin stitched around the bone.
No, it is actually just everything is open right now,
Oh wow.
and the skin will actually
Grow over.
grow grow, grow over the exposed bone.
Oh wow. Exposed bone. Oh,
Mm.
look at that. Wow. 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 I'm amazed at my own foot.
Okay, so now we're going to clean it, and just what we do when we clean it is we just run the wash over it, and then we're gonna pat the wound. We're not gonna actually take a piece of gauze and wipe across
Right.
it because that wouldn't feel good. So we're just gonna basically pat the thing clean.
Okay.
And what I usually do is I usually just take take a whole thing of this and then just kind of saturate it good, and then
So you just kind of wet it and pat it.
mm-hmm.
Okay.
All of this looks really good.
Okay.
Yeah.
I really want to take a picture of that.
Nope, 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 nope.
Why she can't take a picture?
It's so cool to me.
I'm doing a video.
It's your foot though.
Oh, cause it's my foot. Y'all can't take pictures.
Yeah, just cause I mean,
HIPAA.
Yep.
Oh, okay.
Mhm.
What what you want to do on your own is fine, but we can't take pictures of
Right, right,
patients or their wounds or anything.
right.
So is this fresh right here? Like this whole
Mm,
piece right there?
mm-hmm. Yeah.
Well, I got a YouTube channel. If I post it on YouTube, she can always look at it.
Yep, that's true.
That is amazing.
He actually had a revascularization procedure about a week ago,
Oh.
which actually in order to help blood flow down to his foot, and like yesterday when Dr. Alston was in here and I did the dressing change yesterday, like I mean the entire time I was doing this, his foot was like trickling blood down. So
Oh.
that surgery was very, very helpful.
Good deal.
Just kind of getting the area good and clean.
Yeah, I probably post it on YouTube. I think my YouTube channel is Lazarus Ross Resurrection or something like that. A resurrection.
I'm gonna have to find it.
Yeah. It'd be educational video. Yeah, I think I'm gonna name this video Nurse Zack.
Uh oh.
Nurse Zack hooking her brother up.
My sister actually had to have one of her toes removed a couple months ago,
Really?
and I mentioned something to her as a joke, and I think she's actually going to do it. She had to have this toe that you had removed.
Mm-hmm.
She had to have that toe removed, but she still has her big toe.
Mm-hmm.
Told her she should get a tattoo on the top of her foot with an arrow pointing to the missing toe and have it say went to market.
Oh my god.
This little piggy went to market.
Oh my god. Oh my god.
And I think she's actually thinking about doing it.
Oh my goodness.
I'm like, that would be hilarious.
That is hilarious.
This little piggy went to market.
Yeah, dude, she put on some sandals.
You know, the next time I see her, I may have to be like, I'll pay for the tattoo if you actually get that. That would be awesome. Okay, so wound is clean. We're gonna go ahead and change gloves again before I redress it.
This little pig went to market.
Missouri's beating LSU already.
Is it? What you just said?
Missouri is beating LSU. It's still in the first quarter, but Missouri is beating LSU.
Oh my goodness, that just didn't sound right.
I knew it was going to be a rough year for LSU.
Wait a minute, what, they lost the quarterback or something?
Well,
He went to the NFL?
I think like 75% of last year's team either graduated or went pro.
Oh, he done went pro. The boy that got
Joe Burrow,
the one that got the
Heisman.
Heisman. He went pro.
Yep.
Oh, okay.
Yep.
'Cause I was like, I don't see nobody beating LSU.
No, well, it's almost an entirely new team now.
Oh wow.
Yeah. Okay, so the wound is clean. So now we're gonna apply this Sandhill stuff, which will help keep breaking down all of the bad material.
Missouri beating LSU. That don't even sound right in a sentence.
Maybe in like maybe you'd sound right in like basketball or something. But,
Exactly.
All right, so so with Sandhill, you have to apply a pretty thick layer to it. Most of the doctors will say they want it as thick as a nickel, like the actual coin. So I mean, a pretty thick layer on it.
Okay.
So what I'm gonna do, since it's clean and I'm about to apply ointment, I'm just gonna kind of blot it dry just to help it stick a little better. Blot it dry as tenderly as possible, because I know that's tender.
Mm-hmm. Yes, sir. I feel everything you do.
Alright, then we'll just apply it on there. Want it about as thick as a nickel.
You know, all those little touches up in there feel like just little bitty needles up in there. You know how the diabetic needles is, where you don't,
Almost like those pins and needles.
right? Where you don't. It's not a sharp prick or anything, but it's just like those little needles sticking you.
Come on, get off my finger and on there.
Those little tubes of Santil are not gonna. They expensive. Those
Dr. Austin said said that you'll have to see how much your insurance covers, and then go from there. And he said if it's too expensive, then he will come up with a plan B for you.
Well, I know what the tube's gonna cost $50 a pop,
Really?
and I'm gonna need several refills. Cause I've gotten a Santia before my toe first got
Oh, really?
yeah, and it was $50
Mm.
with insurance. Without insurance is what, about 200, 100.
Ooh.
Mm.
But with insurance is $50. It's pretty expensive, and so I don't know whether Plan B might need to look if we can. What is Plan B?
I am not sure. We will have you follow up with them. Home health may even be able to like recommend what Plan B will be. I'm not sure if it'll be some kind of like something like this, but just cheaper, or maybe like one step down from this.
Yeah, but when he do right, he's gonna have to put me some refills on there, several refills on there, cause that what? How long does Santil bottle of Santil last? But
Let's see. This is
day two, this second time using it,
day two. So
my three
one
days,
bottle probably be 3, maybe 4
four
days
change.
max.
Yeah, so I'm gonna have to
So
change that up.
yeah. Of course, as like the wound heals, you'll have to
Need
use
less.
less and less.
Right,
So
right. So we'll start out with the Santil. I might, it probably do.
as it starts healing up more and more,
Right.
you may then be able to go to something a little cheaper.
Okay, cause so $50 a week for right now.
Mm. Can you go get me one more of these?
Yeah, I'm
I
gonna
thought
have
2 would be enough, but I think I was wrong. Uh oh.
Zack.
Oh, hey, thank you. That's why you're here, to keep me in line.
keep you on your toes.
That's right. So, so now that we've applied Santil, the orders are to apply Bosch soaked gauze in wet to dry dressing form.
Okay.
So,
And that's what wound cleaner.
this is just wound cleanser. There's a bunch of different wound cleansers out there. This is the one that Dr. Austin prefers to use on his patients that are in the hospital.
And what's the name of the blue bottle?
Bosch.
Vosh.
Yes.
Okay.
Yep. So now we are going to apply our wet to dry dressing, and we want to make sure that the dressing is moist, but
not saturated.
not saturating. Correct. Because the point is to draw moisture out. And if it's too wet, then there's nothing. Then that's going to be as wet as this. So since there's kind of a recession here, the first one we're actually going to do will be tucked in like that, just to kind of fill everything in.
Okay.
That that way it actually starts to like smooth out the area,
Okay.
instead of it having dips and all that. So
Okay.
that first one will help build up the bulk. And now since this is going to be a smaller area, what we're going to do is we're just going to kind of see that right there and kind of tuck this under just to kind of make sure we get everything underneath as well. Alright, now before we go any further, we are going to make sure to keep its toes dry.
Okay.
So I'm going to take some of this dry gauze, and the easiest way to do it when it's between the toes is to open up the piece of gauze and then just kind of fold it over to make it more narrow.
Okay.
And then that way you can just tuck it between the toes like that.
And you do that to each
toe.
Okay.
Actually, you know what? You can probably.
There you go, to make it last longer. Yeah.
There you go. Cost effective.
Cost effective, that's right.
There you go. That'll work. Okay, so now that we have the toes protected, we're gonna keep going on the wet to dry. And if you want to come over here, Victoria.
Okay.
You can see we still have an area over here. So now we're just gonna kind of fit it to like the actual wound in order to provide bulk there.
Okay.
All right. And then after we have the bulk built up, then we can actually just worry about making sure that everything is covered. Make sure to keep that gauze dry because we want that gauze dry to keep his toes dry. Yep. And let's see. Maybe one more little piece in order to get that spot and get this spot here on the underside. So for that, we'll make this one a little longer. If I can get the gauze undone.